Hi, I'm Tom Dalonzo-Baker from Total Motion Release. I would like to give you a quick technique that you can try. I'm going to try to get through this video in a minute so it's not too long and doesn't block up too much of the computer space. But here's what you're going to do. You're going to test a one-legged sit to stand on one side versus a one-legged sit to stand on the other side. And it doesn't have to necessarily be from this height. Some people can't even do it from this height. So you can try from a higher height. Oops, sorry. Higher height. Okay, and your legs should stay out the whole time. And for those people that are more athletic, you can even do it from a stool. Alright, so I can do it on that leg. But on this leg, it's going to look like I'm not even trying, but I can't even get my activation to occur on that side. Alright, once you've found a good leg versus a bad leg, what you're going to do is you're going to have them do 2 sets of 12. Alright, so on the good side. So this hopefully will show you something, because most of the time if somebody couldn't do anything on the left leg, that's the one we as therapists would work. I'm only going to do 3 reps. I won't be able to talk the rest of the video. So you're going to do 2 sets of 12. 12 is kind of arbitrary, but we try to get them up around those numbers. They only do 6 to 8, that's fine, but we do try to push them. And we rest 15 to 45 seconds in between set 1 and 2. After you get those 2 sets of 12 done, what I'd like you to do is to retest the bad side for 1 rep. Okay, so after you get done, you're going to retest the bad side. See how much improvement they have. Here's a couple tips for you. Take people that can definitely tell a difference. If they can't tell much difference and you can't see much difference when they do it, ignore those. Go on to the next patient or person. Alright, so I ask you to do this. Grab 10 patients. Do this on all of them. If they can tell a difference, keep them in this little, quote, mini study. If they cannot tell the difference, exclude them and bring another person in until you have 10 people. Include yourself too if you do see a difference. And what you're going to do is you're going to do a pre and post test. Number 1, this is a pre and post test. You know, this one can't do it, this one can. By how much and things. But hey, take things you can do, goniometric measurements. Maybe they came into you with a shoulder problem. Use that person. Do pain scale for maybe, for example, back pain. Do somebody with elbow, wrist, neck, whatever the case. Do not select a person. Just say, I'm going to do this on the next 10 patients, because you'll be amazed on what this works on. When I did this the first time on a patient, their bad side improved dramatically, their back pain decreased 80%, and their shoulder range of motion improved. And at that point in time, I said, wow, I want to try this a whole bunch of times. So what I'm giving to you is kind of where I started 5 years ago. It gives you a glimpse into what total motion release concept is and how different it is from the typical physical therapy concept. I hope you enjoy it, and after you do your 10 people, I will actually send you another email if you send me back a summary of what happened. Okay, so tell me about the people, tell me about what they said. I thoroughly enjoy sharing. And as long as you'll share with me, I'll share some more of this stuff with you. So I look forward to it. Thank you for watching, and I'll see you soon. Bye-bye.